The lecture today was just a fantastic with a group inside. Talked about the real evidence that we have about sun. And so as a dermatologist, we're sort of taught that sun exposure is an unqualified bad, sun protection is an unqualified good. And we do know sun causes photoaging, it causes basal cell, it causes squamous cell, it increases the risk of getting a melanoma. But what dermatologists don't know is that there's also a body of literature that sun reduces the risk of dying from cardiovascular disease, reduces the risk of dying from cancer, it reduces the risk of getting autoimmune disease, and the way that it does that isn't known. It really looks like it's not via vitamin D, because vitamin D supplementation hasn't been shown to help prevent those things. And so we may be doing some harm to our patients by telling them to avoid the sun. And it's interesting thinking about that data and deciding, what am I gonna do? I know that it might cause an increased risk of mortality from skin cancer, but it also might be outweighed by causing a decreased risk of mortality from a lot of things unrelated to skin cancer. It's still an unanswered question, but in dermatology, we act like it is an answered question. Like we know sun is an unqualified bad. What I want people to start thinking about is, we don't know. Maybe it is bad, maybe it is good. The data can't conclusively answer that, but we shouldn't just assume that sun is just plain bad.
I think some people feel that the use of cannulas and a retrograde technique protects you against any problems and complications. And while I believe in the retrograde technique, I don't believe that the use of cannulas is a nexus for avoiding problems and complications. And I think problems and complications occur because of unique anatomy, the vascular flow, what's on the other side of those vessels like bone, whether you can put pressure on the vessels to occlude them or whether you actually have to put material into the heart or the lumen of the vessel. So there was a little controversy about that.
My first topic was on bloodless eyelid surgery. A lot of dermatologists do blepharoplasty and a lot don't, and a lot would like to learn. And blepharoplasty is one of those procedures that is well within the realm of a cosmetic trained dermatologist. It's just one of those things, like any surgery that we do, that you have to know the anatomy, you have to know the technique, and you have to be able to handle the complications. And one of the things that was asked to me in the panel is, did I think that dermatologists can do blepharoplasty? And I said, yes. I said, hell yes. So the highlight of my talk was discussing how to do this in a bloodless manner. The eye is very vascular, and if you have bleeding in the eye after surgery, it could have dire consequences. So any modality or technique that decreases bleeding is very important. And I discussed 4.0 megahertz radio wave surgery, and we'll just call that radio wave surgery. And this is a way to make incisions in the skin with little or no bleeding. And when you have little or no bleeding, you have less bruising, faster healing, less pain.